Hello, I'm Emma Hammett from First Aid for Life and onlinefirstaid.com. And today I'm going to talk to you about what happens when you dial 999 or 112 if you are anywhere within Europe. So 112 is the emergency services number if you are anywhere in Europe that takes you through to the emergency services for the country in which you are in. So in the UK, 999 and 112 are interchangeable, which is good to know. So I'm going to take you through what to expect, because although the emergency services receive thousands of calls every year, thousands and thousands, a lot of people haven't phoned the emergency services and they don't know what to expect. So I'm going to go through what happens and how you can help them, and if you want an ambulance, how you can have some of that information ready and able to make things go through that little bit smoother. Okay, so when you phone through initially, the BT operator will answer your call and they will ask emergency, which service do you require? Fire, police or ambulance? And depending on what you say, they will then transfer the call through to the relevant control room. So if you've asked for an ambulance, there will then be a call handler and they will have a screen in front of them which asks for information from you in order to prioritise your call and identify how to help both the patient and you to help the patient whilst waiting for an ambulance to arrive. So the call handlers log essential details and they're going through a triage process to identify the priorities so that they can make sensible decisions as to what sort of help you need, whether or not they need to talk you through how to give CPR, for example, and how quickly they need to act. So they're making these priorities. And there is a set list that they need to go. So unfortunately, you can't jump them through the list that easily. Okay, so they will plus the call handlers and the emergency dispatchers work together. Sometimes it's the same person. And they are deciding and putting the information through to the paramedics and the team in the ambulances to make sure they get the right people out there. So they will ask various questions, and depending on your answers, they will decide whether you need an ambulance, a rapid response car, a motorcycle, a cycle response unit, an air ambulance, or a community first responder. And sometimes you get a mixture of all of them, depending who's there first and how urgent it is to get help to you immediately. So they will also, in their information, advise you whether it is a medical emergency or whether, from the information you've given them, it would be more appropriate for you to go to A&E yourself or to go to the doctor's surgery or the pharmacist. They are trying to prioritise the resources. So first of all, they'll ask, what's the telephone number you're calling from? And that's in case you get cut off so they can get back to you. What's the exact location of the incident? Now, sometimes it's quite difficult for you to know. So I've got various articles on my site about things like motorway markers and understanding how those work so that you can identify exactly and pinpoint where you are if you happen to be on a main road or a motorway. A map reference, they can trace phones, but actually it's much easier for them to get a location if you give it to them. So make it easy. So give them as much information as you can as to where you are. Obviously Google Maps can help you to pinpoint that as well if you've got service and coverage. They want to know what's happened. Is it a major incident, a minor incident? Do they need police, fire service, Coast Guard, or the HEMS helicopter emergency medical service? How many people are involved? What's the age, the gender, the medical history of the patient? That can help them to give the information to the paramedics so that they can start getting things ready and be ready for action as soon as they get out, and that they can call the most appropriate team as well. Is the person conscious or unconscious, breathing or not breathing? This is vital to know. Obviously, if they're unconscious and not breathing, they will want you to do CPR, and they will talk you through how to do it. Obviously, much better if you've been on a first aid course and you know what to do, but if you haven't, they will take you through what to do, the vital steps to start giving that person the best chance. And then, of course, that call will go straight up to the top as a real urgent call to bring in. What part of the body was injured? Is there any serious bleeding? Does the patient have any chest pains? All that helps them to prioritise how urgent this call might be. Has there been an assault? And if so, is the area safe? Because they won't be sending paramedics in unless the police have gone in and made sure that the area is safe. If there's been a car accident, is anyone trapped in the vehicle? Obviously, they need to get the fire brigade out to do the sardine can off the top of the vehicle. Couple of myths. Dialing 999 doesn't necessarily mean that an ambulance will be dispatched. Obviously, they will ask and prioritise, and they will only send an ambulance out if you really need one. If you arrive at hospital by ambulance, it doesn't mean you will be seen first. There is a triage desk in the hospital, and the nurses will be asking the same questions, and they will be saying, actually, do you know what? You're not our most important person in here, I'm afraid. You're not the most life-threatening. And just because you came in an ambulance, I'm afraid you have to wait your turn like everybody else. Couple of things to do whilst you're waiting for help to arrive. Stay with the patient, stabilise them. If there is first aid that you can give that is appropriate to give, then make sure that you are giving appropriate stabilisation and looking after them. If your house name or your house number can't be clearly seen from the roadside, make sure that the ambulance service know this and ask someone to wait outside to direct the crew to the right place. If it's dark, turn on house lights and pull back curtains. If you're in a vehicle, put on hazard lights, wear a fluorescent jacket if you've got one. Secure family pets, because sometimes they all get a bit hyper about something happening, an accident, and they can attack the emergency services, I'm afraid. So secure them safely and reassure them as well as the casualty. And if you're able to, it's really useful to have the patient's medication, their GP details, and any information about allergies, because that can be really helpful to give to the emergency services when they arrive. I hope that's been helpful. That's Emma Hammett from First Aid for Life and onlinefirstaid.com.